Today I would like to give you a unique way and natural way to lower your blood pressure without taking medications that can harm you. Most medications we take today do have side effects. For example, cholesterol medication depletes you of vitamin D and coenzyme Q10. And if you have a low vitamin D status, your increased risk of death is markedly increased. So the natural way to lower blood pressure is to, number one, increase the curve of your spine from the side position, so increasing the curve of your low back, increasing the curve of your neck, will reduce spinal cord tension. The second thing we have to do is to analyze the markers for inflammation of your arteries. Most medical doctors will measure your LDL cholesterol and your HDL cholesterol. What the naturopathic physician will do, or the chiropractic physician, is he will analyze all the different types of cholesterol, including the small particle size and the large particle size. If you have more small particles, it's much more likely to clog up your artery. And also we measure the number of particles carrying the cholesterol. So, to review, the medical doctor will only measure HDL and LDL. There are a few who do the entire study though. We do what we call a complete study of all the different types of cholesterol, including the size of the cholesterol particle and how many particles are being carried. LDL particle number is a much higher predictor for heart disease than total LDL cholesterol. So once we analyze all that, if you have a high particle number, we may use things to lower your cholesterol as well as just like a medical doctor. But instead of using the drugs, we're going to use red yeast rice, for example, along with niacin, which is a B vitamin, along with omega-3 fats, fish oils, and other types of natural ingredients to replenish the vitamin D and the coenzyme Q10 you're losing from taking a statin medication. Cholesterol medications are definitely dangerous because they lower your cholesterol too low. Your cholesterol is important for preventing your arteries from breaking. If you have too low a cholesterol, below 130, 140, 150, then your increased risk for hemorrhagic stroke or the artery breaking is markedly increased. And all your hormones, steroid hormones, are made from cholesterol, including testosterone, including progesterone, including DHEA for the adrenal gland. By lowering the cholesterol too low, you're lowering your male hormone testosterone, and that's extremely important for heart function. So, the natural approach is to analyze your hormones. Bring up your testosterone if you need to take it up, which most men today are low in testosterone, even at a young age. Understanding how all the hormones relate together for the heart. Vitamin D, for example, is not really a vitamin, it is a hormone. It's made in your skin, it goes to your liver, then your kidney, and is transformed into its active form. Measuring vitamin D status is a very important thing to do. By getting good vitamin D status, it will lower your blood sugar, and most artery conditions are tied to high blood sugar. So, to reiterate and to summarize, for today, when you go to the doctor and he says, oh, your cholesterol is fine, did he measure your particle number? Did he measure the inflammatory factors for heart disease such as homocysteine or C-reactive protein? Did he measure how much clotting factors you have? So most people that have a heart attack or stroke, it's not because your artery keeps getting clogged up and clogged up and clogged up. Part of that plaque inside your arteries, which we all have, breaks off, forms a clot, creates a thrombus, and then you get a heart attack or stroke due to ischemia or lack of oxygen to the heart or to the brain. So what we do is measure the clotting factors, called fibrinogen, and some other factors. We measure the inflammatory factors, such as homocysteine or C-reactive protein, and we measure the LDL particle number and the size of the particles for LDL cholesterol, and then we compute your insulin resistance score. How much insulin do you have floating around in your bloodstream, as well as glucose? But number one thing we want to do is release spinal cord tension, because people who walk around like this, have a lot of tension on the brainstem, and your brainstem controls your heart rate and your breathing. When a sharpshooter wants to kill somebody, where does he shoot? Not through the cortex, the brainstem. So by positioning your head in gravity in a better position, absolutely will lower your blood pressure.